Welcome to the Arizona Clinical Informatics Educational Series on Cerner Power Charts lesson number 11, Discharging a Patient. In this lesson, we'll be reviewing the steps related to discharging a patient. For the nurse, it all starts with the care compass. Here we see the list of our patients. If you look into the center column, you will see that the top two patients have the word yes under the discharge column. This indicates that there is an active discharge order. Prior to discharging a patient, you'll want to make sure that all of your tasks are completed out. You can see on this patient, we are completely up to date on our task and can resume with the discharge process. Let's select our patient to open the chart. Once we've opened the chart, we are defaulted to the Orders In page, and we can see under the header of ADT patient status that there are two discharge orders, discharge lab order and discharge patient. We'll want to review these orders to make sure we have a full understanding of what is about to occur. Clicking on the discharge patient order, we can review the details of the order. We can also look at the comments tab as well. Why is a review important? Because the ordering provider may have placed a DC order, but he or she may have placed comments that makes this a conditional discharge. For example, patient may be discharged after AM labs are drawn and if potassium level is within normal range. If you see a comment like that on a discharge patient order, it has now become a conditional discharge order and we have to wait for further actions before we can continue with the discharge. The discharge lab order is essentially a script that is printed on the patient discharge summary that serves as an order for follow-up for the patient to have labs drawn. The patient can take the DC summary to any lab and present this as an order, and they will perform the steps listed out in the order. Let's review the discharge lab order. Here we can see that this is a discharge lab order for the patient to have drawn a BMP with a focus on potassium levels in 1 week. We'll need to make sure we remind the patient of this when we give her the discharge instructions. Back onto our patient's chart, we see that we haven't refreshed the page for over 30 minutes. Let's do so now, just in case there's more orders that we might have missed. Before we close out of this patient's chart and look at our second patient with the discharge order, we need to review the reconciliation status on this patient. We need to verify that there has been a discharge MedRec performed, and we can see that it has been completed due to the fact it has a green check mark. We are good to begin the discharge process on the patient. Let's look at the other patient with the discharge order. Let's click on the discharge patient order. Review the order for clarity. Everything looks good, so we can close this order. However, we cannot discharge this patient yet because the reconciliation status for discharge has not yet been completed. We better find that doctor before they leave, or this patient may get delayed in getting discharged. We've contacted the doctor and he is going to reconcile the medications. So let's get to discharging the other patient who is already ready to go. Back into the patient's chart, we want to select from the toolbar the icon of Depart. This will open up our Depart process. To the left, we see a checklist of things that need done. Each part of the checklist shows you who is responsible for that part. We see physician and nurse listed. As the physician completes his part of the checklist, we see the circles on the left filled to blue. This indicates that that part of the checklist is complete. We can see that the discharge diagnosis is entered. The MedRec is complete and the physician portion of the follow-up is complete. And so is the orders. The follow-up section is only partially filled in, which is indicated to us by the half-filled circle. To the right is the body of the text for the patient discharge instructions. This data is being built based upon the data that is being entered on the left-hand side and through educational documentation from throughout the patient's stay. Let's now go into the follow-up care section. Here we see that the physician has placed a request for the patient to follow up with physician test within 5 to 7 days. Some patients will have an exact date and times for follow-up, as some appointments are required to be set up prior to the patient being discharged. We can add or remove data from this list. Everything on follow-up is in order, so let's click on the Instructions tab and enter some patient education. We've discussed this in lesson number 2, Overview of Cerner, but this section is where we can add discharge care instructions to the patient. We default on the suggested instructions. Because of promoting interoperability requirements, there must be at least one suggested instruction added to the patient's discharge. Double-clicking on acute coronary syndrome adds it to our scratch pad for the patient. Let's continue adding more education. We need to add a heart failure instructions for the patient. So we have selected the All tab, which allows us to search all education instructions that are available. Most all educations have other languages besides just English available. If I need to add more, I would click on the drop-down box next to language and select which language I would like to pull in. We've added the Spanish version of heart failure to the scratch pad. Each instruction can be modified, if needed, for patient specifics. In this instance, we want to add our outpatient cardiac rehab contact information to the instructions. When we have completed all of the necessary follow-ups and instructions, we can select the Sign button. This will bring us back to the Depart Process screen. We can now fill in the follow-up care bubble. Everything we add from the left-hand side of the discharge process is being added to the patient instructions on the right-hand side. Our next section to complete is medication leaflets. By scrolling through the discharge instructions, we notice there is a medication notes section. We can review these to see what medications we need to add to the instructions so the patient is educated on all their medications. We've identified the medications that we need to educate on, so we can select the icon next to medication leaflets. Now we can begin to search and add the medication leaflets for this patient. Once we've identified all of the medications we need to add, we can select the OK button. If you select the medication in error, just highlight the medication leaflet and select the red X. Back at the Depart process, we can now scroll through the instructions and see that the leaflets were added. We've completed this section, so we can now fill in the bubble. Now let's work on the discharge summary for the patient. The nursing discharge summary documentation window pops up. We can now begin completing the process. Over on the left-hand side, you see a list of items to complete. Notice that the transfer patient and pain scales are grayed out. They will become activated if certain items are selected in the documentation process. Having completed all of the nursing discharge instructions, we can move on to the discharge assessment. On this screen, we see the first query of reviewed agree with last patient assessment. This only has a yes response to it. If you do not agree, then you skip this query only and fill out the discharge physical assessment after you have completed the remaining data fields relative to this patient on this screen. Notice the blue text next to the first query. The text states, vital signs should be documented on every patient at time of discharge. If you do not agree with the last documented shift assessment, select the Depart Physical Assessment Power Form and document your physical findings. For this demonstration, we'll answer yes. Times that we wouldn't want to answer yes: if we didn't perform a shift assessment on the patient prior to discharge, or the condition of the patient had changed since our last documented shift assessment. Here's a completed example. We now must move down to pain assessment and complete all data relative to this patient. When completed, select the green check mark to sign. The discharge summary is now completed, so we can fill in the bubble. Let's view the discharge physical assessment. This is a complete head-to-toe assessment. it would need to be completed if we had not answered yes to the question of reviewed agree with last patient assessment under the discharge instructions. But if we go back into the discharge summary and go to the discharge assessment, we see we answered yes to reviewed agree with the last patient assessment, so this eliminates our need to complete the discharge physical assessment. Please do not answer yes to this question if you haven't assessed the patient. At this point, we want to do a final review of the patient discharge instructions to make sure nothing has been left out. Scroll through the instructions until you reach the end, reviewing the data as you go. When you reach the end, you'll see the patient and nurse signature lines. You will be collecting nurse and patient signatures at time of discharge. You will retain the copy of this separate page and present the patient with a signed copy at time of discharge. The copy you retain will be placed into the patient's chart to be scanned into the system. At this time through Cerner, we do not have an electronic signature process. There's another section in the patient discharge instructions that requires a manual completion by the nurse on all patients being discharged from the hospital. This is the medication notes. You must fill this out and copy this page to be placed into the patient's chart and scanned into the system. You will be filling out the blanks on each med for the last dose given and take next dose. We're through reviewing and will need to sign the depart process. The sign option will print copies of the patient discharge instructions to a printer that has been pre-associated with the computer you are working on. Once you have printed it, you can save and close. If it did not print, you could select the print button here. Back to the patient's chart, we can go to the Documents In page. Here we can select the Discharge Documentation folder. We want to continue expanding the folders out until we can see that the patient's discharge instructions are retained in this folder for viewing. If you happen to perform this on the wrong patient or made an error, you could right-click here and unchart this. Once the patient is discharged, we can remove them from our patient list. Right-click on the patient and select Remove Patient from List. Congratulations, you've reached the end of Lesson 11, Discharging a Patient.